Hello, hello, good morning. Welcome to Postpartum Perspectives, the place where we talk all things postpartum and newborn care. I'm one of your hosts, Julia Kavanaugh, and I am a birth doula, postpartum doula, and newborn care specialist. I'm also one of your teachers at Postpartum Doula Academy, and I help out in Gentle Ventures as well.
Thank you, Julia. I'm Nancy Ham, and I am with Gentle Ventures. I am a newborn care specialist. I am also a trainer teacher, also a mentor. And Julia and I have kind of joined ventures here, and I think we're doing amazing. And we love to talk about different subjects, and today it's going to be circumcision.
Woo.
Oh,
Okay. So, Nancy, on the other side of this, I want you to know that I love you and we're still going to be friends.
okay. All right. And that's a deal that you got a deal there.
Okay. Okay.
And you have to understand that as we discuss this, I'm more for circumcision. She's more for leaving a baby intact, leaving a baby intact.
Yeah.
Um, and it doesn't matter to me or to Julia what way you go. It's just being informed and
Yeah.
knowing that you do have choices,
Yes.
and that as parents we have choices when the babies come. Are we making the right choice, or am I going to circumcise my baby and 20 years from now he's going to say, why'd you do that to me? Or, and I've got a friend and we talked yesterday and one of her boys is circumcised and one is not, and they
Wow.
both come to her and said, thank you for circumcising me and thank you for not circumcising me.
Wow.
And so, it's just,
Wow.
it's probably as they get older and find out the pros and cons that they say yes thank you, or it's such a hard decision for a parent to have to make, and should
Oh,
they
yeah.
make it, that's the big thing.
Yeah.
and,
Yeah.
and my big
That, go ahead.
okay, my big thing is it's so easy at 1 day old.
Mm.
You add, I had one, all my babies were circumcised, two of them in the hospital.
Yeah.
The third, the doctor says no, he wasn't going to circumcise in the hospital. He wanted to wait till the baby was 6 weeks old. Biggest mistake of my life.
Ooh.
It was so hard for a 6 week old compared to the day old. The day old was a breeze. The
Wow.
6 week old was not at all. It was days of agony, and I'm so sorry that I waited for 6 weeks to do it.
Wow.
So I can imagine a grown man trying to make that decision, and I would assume that it's not going to be an easy road.
Yeah. Yeah. There are, I was looking into the history of circumcision and the cultures that have practiced it throughout history, and it's fascinating.
Yeah.
So Egypt is one of the oldest places where we found archaeological evidence of circumcision, but it looks like it was practiced as a rite of passage around the age of 13.
Oh, yes. Yes, I've heard that. Yeah.
Yeah.
Oh,
And then of course in Judaism, the bris, and that's thousands of years old.
yes.
But it didn't really come into the mainstream in the Western cultures until the 1800s
Oh,
during the Victorian era. But the reason for it is they thought that the Victorian era was really concentrated and focused on purity. And there was a doctor named Dr. Kellogg, who's the same doctor who created Kellogg's cereal.
oh boy.
Um, yeah, he thought if we remove the foreskin, we will decrease the instance of will decrease the temptation of men to masturbate.
Oh, see how well that worked.
Right. Right. Well, there you go. Right. But the decreased temptation to masturbate would lead to a purer soul and a better life. That was the thought process. And that swept through the West. And
Wow.
it's so fascinating. And then in the 1940s and 50s in America, uh, there was a big push for hygiene. Um, and we started making it like a norm to circumcise in
Yeah.
our hospital.
I had my babies over 50 years ago,
Yes.
and it was that wasn't really a question. It was, I mean, my father was
Yeah.
circumcised. Oh, that's a good question. Was my father circumcised? I think he was. I think he
Yeah.
was because I had him when he was dying, and I'm trying to remember his penis when he was when I was changing him. Sorry about that.
Oh
Too
man.
much
Yeah.
information. But my father was circumcised. My brother was circumcised.
Yeah.
My boys were also. There was never a question. It was never, well, should we do this? It
Yeah.
was just the thing you did. The
Yeah.
questioning I has really started within the last, I'd say, decade. Really
Yeah.
started. Really started. I know that there's people that did not circumcise before that, but it's really being questioned in the last decade.
Well, and it's fascinating because I was looking at the demographics, like the where in the United States is it practiced the most? And you've got the West Coast, California, Oregon, um, Washington, really low rates of circumcision, at least in the hospital.
Okay.
But then you go to the Midwest, Michigan, Illinois, which is where Nancy is from,
Yeah.
which is where you're from. And there are hospitals where it's presumed
Hmm.
unless the parents say, "Oh, we don't want that." So it's just a part of standard care. It's
Yeah.
not um and the thing that uh that goes along with both of these places is that in the West, insurance does not or state insurance does not cover medically unnecessary procedures or elective procedures. So the
Is
West
that considered that thing?
considers circumcision an elective procedure, whereas the Midwest, the healthcare, the state health insurance does not consider it in certain states, does not consider it elective. They consider it, um, what's the opposite of elective? Medically necessary.
Yeah.
Yeah.
That is really interesting. Now, in Arizona,
Yeah.
now
Yeah.
hospitals don't do it.
They, well, I think it depends on what hospital you're going to.
Maybe, but
They
I know
don't push it. Oh,
the majority of them don't do it. And I have not practiced for a year, maybe a little bit more, a year and a half now.
year and a half.
But when I was an NCS, I was getting more and more clients who were having their babies circumcised at the doctor's office because the hospital would not do it. It was too much of a liability for them to do it.
Interesting.
So they were not doing it. Now, I'm sure there's probably still hospitals in Arizona that do that, but not the major ones here in
In
Phoenix.
Phoenix.
I am aware of. Yeah.
Interesting. Okay.
So I
Okay.
think that is really, really interesting. Let's get into a little bit of the what can I say, pros and cons. I'm not sure if that's what we want to say.
Yeah.
I just want to stay here that the AAP does not recommend circumcision. It's not that they say don't do it; they're just neutral on it.
So yes, so I was looking at the fine print of that,
Huh?
and tell me if you noticed this too. What I saw was that the AAP said that there are benefits,
Yes, to circumcision.
but to circumcision, there are benefits to circumcision, but those benefits do not outweigh the risks enough to make it a blanket statement that all male infants should be circumcised
Let me see if
automatically.
Yeah, the only note I have on here is most medical organizations, including the AAP, do not recommend routine circumcision for all boys.
Yes,
That's
yeah.
that's in my 6 page of notes.
That's beautiful. That's beautiful. I've got mine up here. Yeah. Because okay, well here's a con. Let me just because we're on this point. The complication rate for circumcision is estimated to be between 2 to 10%.
Oh,
2
see,
to 10%, ranging from mild to serious,
and I
according
have got
to the Canadian Pediatric Society and the AAP.
Wow, and I've got something much lower. I know that. Just see, you're getting ahead of me here, and I'm just
Oh
little.
no.
Here, they said the low comp, compula, comp. Say the word for me. Complication. Thank you.
Complication, yes.
Rate in infants is under 5%. 0.5%, not 5%. 0.5%. So that's probably what was yours?
2 to 10%.
Oh no, mine is under 0.5%.
Wow.
So that's a huge difference. When performed in infancy by
Yes.
a trained provider in a sterile setting, the
Okay.
complication rate is very low, under 0.5%.
Okay, so maybe the AAP and the Canadian Pediatric Society are taking in the global context
And
of
they
like
could, yes,
if you're doing it in, an
Africa.
unsterile place or at a home and it's a religious ceremony, but they're not using the proper uh well, that's huge. So I like what you're saying. So as long as it is in a sterile environment, what were the other parameters?
Just a minute here. Sterile setting, trained provider.
Yeah.
Sometimes they have midwives who are doing circumcisions now, and
Okay.
that's causing issues.
Interesting.
Yeah, because they sometimes are not trained properly or don't know what they're doing or don't know what to do if a complication arises. So
Okay.
I don't know how long that'll last, but yeah.
Okay. Well, so Nancy and I have different numbers, but as you can see, like it depends on what your focus is, right? Like when you're doing research, if you're looking specifically for what are the risks and you're looking in a uh the best ideal situation, which would be in a Western, am I going to put my foot in my mouth right now? Maybe.
I
Just
don't
you
know.
want sterilized
And sometimes when you go to a doctor's office, is that a sterile atmosphere?
environment.
I mean, come on, they got sick babies going in and out, and is that actually a sterile? Because I know that they don't do any, they take them into a room. I've been to one, I've seen one, and it was
Yeah.
nothing. I mean, they used cloths to cover it up, and all this,
Yeah.
but I don't know that the whole environment was sterile. So I don't know.
That's interesting. Yeah. No, that I would love to like look more into that specific
Yeah.
portion of it. But yeah, okay, so that makes sense. If it's in a sterile environment where there's a doctor who is trained in their specialty of circumcision, that the risk is under 0.5%.
Yeah.
Yes.
Well, I know that in my whole career, I've had one baby, and it was not one of my babies. One of my ladies called me and said, Nancy, here's what happened.
Uh-huh.
The,
Okay.
the pediatrician blotched the circumcision, sent the baby home saying, oh, it's fine. She says, I looked at it. I knew it wasn't. And so she called the dad right in. She didn't call the mom in. She called the dad in and said, look, we need to fix this now. And it's imperative that if something does happen, that you do get it fixed ASAP.
Yes.
And I always tell people who ask me, go to a completely different clinic in a
Yes.
completely different town if you can,
Yeah.
and have it re-examined and fixed. Because if
Yeah.
you go to the same clinic, they're going to be liable, so they're going to say there's nothing wrong, or they're not going to blame the doctor or whatever. So just be really careful if something does happen.
Yeah.
Boy,
Yeah.
I guess we're giving kind of the negative to all this.
Well, all right. Why don't you go and step in a little bit with what is the positive?
Well, one of the big positives is just a minute. It's UTIs. I know that you have a
Yes.
much lower risk of UTIs in infants.
In in
In
in
infants,
infants in under the first year.
yes, about 10 times less likely to get a UTI in infancy if they are circumcised. And why does that matter? Well, it's because that the UTIs in a baby can be really serious.
Yeah.
They can lead to kidney infections, and they can lead to hospitalizations and IV antibiotics and things like that. And we don't want to get into that kind of stuff with babies. Well, what happens is the foreskin traps the bacteria near the urethra, and removing it just helps that risk of infection and bacteria go down
Yeah.
when they remove that foreskin.
Yes.
According to the American Academy of Pediatrics, UTIs occur in 1 in 100 uncircumcised babies and 1 in 1,000 circumcised babies. So there's a huge difference, and that's one of the big differences. Um,
Yeah.
and
That would be a pro. That would be
that,
why you
that
want
is
to
a
do it.
definite pro. And later on in life, it reduces the risk of certain kind of STIs like HIV, believe it or not.
That
Because,
is so fascinating to me.
yeah, see, what happens is the foreskin contains target cells for HIV, and it creates a warm, moist environment that supports the viral survival. So removing it decreases that exposure and helps prevent microtears that can serve as the vital entry points.
Okay, Nancy, you know what I'm going to do right now?
You're going to circumcise your firstborn.
I'm going to no, 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 I'm going to say, all right, so that kind of sounds like a female, right? Women have folds that are moist and trap bacteria. So along that same thought pattern, why wouldn't medically we just get rid of the folds that trap bacteria for women if that's what we're concerned
Well,
about for men?
isn't that what they do in some countries? Get rid of that?
Yes,
That
it's called, yeah, female circumcision.
circumcision. Yeah.
Yeah, and they do it at age 13.
And
Once
but
the
I think doesn't that remove for the female? Doesn't that remove all sensation?
um it depends on how thorough they are. It depends on how thorough, and they're definitely not doing it in like a sterile environment.
Right, right.
It's a yeah. So yeah, and that's female circumcision. They remove the clitoris and the parts of the labia, which are parts of the vagina. But I guess so, like, we don't cut off any other body parts in the Western culture, right? We don't cut off any other body parts to prevent future infections. We treat the infections when they happen and if they arise. So circumcision is surgery that is non on a non-consenting child. And it's not medically necessary yet. We're doing it to prevent something. So why not do it to girls? Okay, for the
Oh,
record, I'm
yeah,
not advocating for
yeah.
circumcision for females. I actually don't think anyone I would rather take the risk for UTIs and keep both genders intact, but to play devil's advocate, you know?
Well, and that definitely is something to think about. I hadn't even brought that into my world of thoughts to say.
Yeah. Yeah. But I didn't know about the HIV thing. That's
Well,
very
it's not only HIV either, it's also herpes and syphilis. So there's a couple of things that it can, and it's also very much easier hygienically
mm-hmm.
to take care of a and which is most, how can I say that? Some guys are not
Uh,
exactly,
some adult
thank you, you can
males
say this for me,
are not taught how to properly care
clean
for themselves,
themselves. Right.
clean their
And if they were circumcised, they wouldn't have to be taught because
right.
there's nothing to it. But if they're uncircumcised, it can really cause a lot of issues if they do not hygienically take care of themselves.
Yeah, it's important. It's
Oh, yeah,
important to teach.
it's very,
Yeah,
very important.
yeah.
Um, what else have we got here?
Well, I have some statistics of
Okay, go
like
ahead.
where we are right now. So, national newborn circumcision rate in the US right now is 55 to 60%, according to the CDC, but that was in 2020, so it might be a little bit
Okay.
different now that it's 2025.
Do we want to bring up the share screen I have, or is that not applicable right now?
I think you could bring it up. Yeah.
Let me bring it up because I got a little. There is a Facebook page. It's called America Intact,
Mm.
and they've got a lot of information on there. And I got this off of there, and it's just a little chart kind of a thing that shows what is your opinion of newborn circumcision.
Oh, I like, okay, so required 5%.
I think it should be required.
Only 5% think it should be required. Okay, so it's gone down from 10%.
Right.
Only only 17% think that it's necessary, down from 26%. Optional, well, it is optional. So it's about 50-50. And unnecessary, 20%. That's up from
So
9%.
that's gone up
That's gone
quite a bit.
up.
Yeah.
Unnecessary. And harmful, 12% think it's harmful, up from 5%.
The only,
Interesting.
yeah,
Okay.
the only one that I disagree with, I don't think it's harmful. I mean, like in a rare instance, it can be,
Yeah.
but generally, if it's well, like we said, if it's in a sterile facility by a doctor who knows what he's doing,
Yeah.
it's not. It's
Well,
not.
but so here's where I question that, right? Like the foreskin has 20,000 nerve endings.
Okay.
20,000, that's a lot. And we're just getting rid of them. We're just getting rid of them.
But
It and it is painful for any being to have 20,000 nerves removed. Yeah. What?
have you found a man that it makes a difference?
I mean, no, no, like truly, no.
Seriously,
Like,
I
like
mean,
as their adult selves, I don't think, and once, like, does the baby remember all that stuff like
yeah.
that? No. Um, there are support groups though for men. I actually found a few. There's something called Your Whole Baby and Norm, and these groups offer support and education for men who are working through feelings of having been circumcised without their consent and feeling a deep sense of loss and betrayal.
Don't you think they should just get over it?
Oh,
I mean, to
Nancy.
tell you, there's nothing they can do about it, Julia. Just get over it and live your life.
But what we can do
Go to
about it is
support
not do
group.
it in the future. Well, or leave it to them to do medically if they want to when they're older.
Yeah, and how many guys are going to want to do that? I mean, I talk to my boys about fixing the dogs, for instance. And,
Yeah.
oh, we're going to get the females fixed because of males, so I can't go through that. And I'm like,
Oh. Yeah. Yeah. This is protect it, right? Yeah, it's
protection. Oh, protection is protect that piece of their anatomy with their life. I mean, it's
yes. Yes.
very precious to them. They're not going to get it cut off at
When
probably.
they're older.
Yeah,
But
that's something
good.
I did look up. How many um, people,
Yeah.
men get circumcised after their teens, say for instance, or as when they get older? What's the percentage of men that actually do get circumcised when they get older?
I'm checking that out right now.
You're looking that up.
I'm looking it up.
You can find
Um,
anything.
um, it's very low. Less than 1%
Yeah,
in the United States. And across the world, less than 6%. But still, wow, 6% is quite high, much higher than I thought it would.
I wonder why
Most
around
of
the
it,
world it's so much higher.
most of it is because of medical
Hygiene.
conditions, including, I might say these words wrong, but phimosis, which is a very tight foreskin,
Yeah,
recurrent infections. So this is why you would want to do
yeah,
circumcision. A
yeah.
tight foreskin, recurrent infections, balantis, which is an inflammation of the glands of the penis,
Uh-huh.
and cancer prevention in
Cancer
high
prevention.
risk in high risk cases.
Yes.
Yes.
Yeah, they said that cancer of the penis is very, very rare,
Yeah.
but it's even rarer in circumcised than
Yes.
it is uncircumcised. I might even have facts on that. Let me see if I've got any percentages on that.
I have a voluntary adult circumcision for people in for personal or religious reasons is rare, but it's more common in regions like Africa, like for the HIV prevention
right.
program.
Yeah, I believe that.
That makes sense.
Well, so then there's the cultural, religious reasons to be circumcised. So
Yeah.
those are things that really nothing can be done about. Those are
Yeah.
religious and cultural reasons, and
Yeah.
that's just the way it is.
Yeah.
So, so we won't even discuss that. Um, I did want to talk. Oh, I guess it's your turn. Okay.
No, 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 no. What did you want to talk about?
Well, no, I was going to say I did want to talk about how to take care of an uncircumcised penis in an infant because that's what we do.
Yeah,
But
that's
I
right.
don't. But what else do you have to say about the pros of getting of
Of, of,
leaving a
of
baby
staying
intact?
intact.
Yeah.
Um, I think basically it's just bodily autonomy, giving the infant the ability to choose what happens to their body when they're older. If they want, if they want a
Yeah.
procedure done, to have it done, unless it's medically necessary. And most circumcisions are not medically necessary.
Don't you think though that regardless, the parents make the decision? Because the baby
Absolutely.
that the baby is who is uncircumcised, we found looking at the percentages is not going to get circumcised later. So it doesn't
Yeah.
really matter if the parent chooses circumcision or uncircumcision. It's not fixable. It's not unfixable, but they're not going to do it.
I mean, not unless it's medically necessary.
Unless it's medically necessary, they're not going to do it. They're not going to just say, well, I think I'm going to try to be uncircumcised here, so let's go to the doctor and get uncircumcised. They don't do that. I mean, it's not as
No,
simple as that. That's
no.
huge, huge things they've
But
got away.
but it's actually possible to lose the foreskin later in life if you want to. Whereas if you want it reattached later in life, it's a much harder thing to do.
Well, yeah, I would probably say it's pretty. Do you know that an interesting fact, just a minute. I want to be sure I say it right because I don't want to blow this one. Bum, 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 bum. I've got to find it because I've got so many notes on this shit. Large hospitals
Yes.
make mega bucks by selling baby boy foreskins to companies that make expensive facial creams.
Oh, wow. Wow. There you go. The
So I was
incentive.
not I was not impressed by that.
No. And they also sell the well, I don't know if this is what do they do with all of the placentas?
Right, right. And they probably do the same thing with that.
I mean, I can't say that I know for sure that
Mhm.
they sell them, but it would be a huge waste of money to throw those things away.
Yeah.
Yeah.
They have to have somebody knowledgeable enough to understand what nutritional value is in the placenta. And a lot of
Well,
times these,
no, but for the stem cells, you can sell them to companies for the stem cells. One placenta is worth about $50,000 on the black market. A
well, then I'd
healthy
be real
placenta.
surprised if hospitals weren't doing it.
I would too.
They just better not get caught
Yeah.
because they get caught selling somebody's placenta and there's going to be big trouble.
Yeah. Yeah.
Yeah,
But it's like, do you want your placenta? No, we'll take care of it for
yeah,
you.
yeah.
$50,000. We'll take care of it for you.
Wonder. That's a really interesting thought.
But
Hmm.
and well, so also the foreskin does protect the glands of the penis.
It does.
Um, which is why humans evolved to have a covering, right? Like the
Mhm.
and that's the part for me that where I'm like, oh, why are we getting rid of some I understand lower risk of UTI, lower risk of some STDs later in life. Um, but if we teach our sons how to care for themselves properly and to use protection and to get tested, I mean, to get rid of something that nature gave us is tricky for me.
I don't know if I even want to say this, but I'm going to
Oh,
because
do it, Nancy.
it's me.
Say
It's me. A hand job is much easier with a
it.
uncircumcised man. And here's
Is
why.
it?
Here's
Okay,
why.
okay,
It's
why?
because there's a lubricating function. Here we go. There's a lubricating function that automatically occurs in a uncircumcised male.
Oh, it's easier with
It's easier with
circumcised. With
uncircumcised.
uncircumcised, that makes
Yes,
okay. Yeah,
yes,
because the skin can pull either direction
right. And
more
it
easily.
lubricates while you're doing it by itself.
Oh, interesting. Nancy, I don't, okay, yeah,
See, that's
yeah.
the kind of research I do.
This is, well, that's a pro for leaving
It
intact.
is. It is. I'm
Um,
sorry.
no, that's great. What I love though is like there it's it's a nuanced topic and what you said about ultimately it's every parent wants to do what's best for their child. So and the children that choose to come to each parent, because I believe that the souls choose their parents
I do too.
because and I think that as souls choosing their parents, they know these people are going to help me have the body that I need to have for this lifetime. And so if your baby needs to be circumcised, they're going to need to be born to a household that honors that. If they need to not be circumcised, they'll be born to a household that honors that. So just trust yourself, whichever road you choose.
And don't think down the road to when your son is getting a hand job. That shouldn't be part of your equation for your decision.
Oh my gosh. Yeah. Yeah. He'll have a great time either way.
Either way, don't worry
Either
about it.
way, they'll have a great time.
Don't worry about it.
Um, was there to tell us about taking care of
Yeah, let's just talk a little bit about um, taking care of an uncircumcised penis, because
no
there's
wait,
there's a lot.
uncircumcised?
What's that?
Uncircumcised.
Uncircumcised,
Oh, intact. Okay.
intact.
Okay.
Should we just
Okay.
say intact? An intact penis. Um,
Nancy, we just did that.
so I'll sit on my hands. That's
Oh my
probably a
gosh.
good
Okay, intact. Okay, here we go.
intact. Okay, I've got to find my notes, because although I know how to do it, I don't want to do it without notes because I might say something wrong.
Mm.
Okay, first you're going to leave the foreskin alone.
Yeah.
So you don't try to retract that. Now, when I first came into this business, which was like over 30 years ago, the ladies were taking Q-tips and jamming them up there and going around like this so that they could clean out the skin or the penis under the foreskin.
Oh my
And
gosh.
I was like, no, you've got to stop that, because that'll rip that skin, that foreskin, and it can cause irrevocable damage. You've got to
Yes.
stop that. So there, you do not ever retract that foreskin. It is actually attached all the way to the end of the penis when the baby is born, and probably for the first, I've
Few
got it,
years. I
first
have a
2 years
friend.
until they're 13 or 14 or something like that. It's quite a while.
I
It
have a
starts,
friend who has a son, and he's 3 years old, and his foreskin is just starting
it's
to
starting
retract
to,
a
yeah, I
little
think,
bit.
somewhere, I thought I read that it was at adolescence, pulling back the foreskin at any age unless it naturally becomes retractable, which can take until adolescence.
Okay, so yeah, it can
Yeah,
take until so
yeah,
her son's just a little bit earlier. I
right.
mean, like it's starting.
It's
It's
starting,
mhm.
right. It starts to do it on its own. Um, so in infants and young boys, the foreskin is naturally fused to the
Okay.
head of the penis and should not be pulled back at all,
Okay.
ever.
Yeah.
So I basically tell my ladies to treat it like a finger.
Yeah.
You just wash it like a finger. You don't try to get under anything or anything. You just wash it like a finger.
I
Um,
love that.
and you should wash it with warm water,
Hmm.
outside only. Use a soft cloth. No scrubbing is necessary.
Yeah.
And mild fragrance-free soap is fine.
Yeah.
And then you just pat it dry. And no special products are needed. You don't need to go out and get powders, antiseptics, cleansers. Just warm water, and
Yeah.
just clean it like that. And then, like I said, you teach your children how to do that, because when they get older, that foreskin will be retractable,
Yeah.
and then they do have to clean. Am I correct on that? Then they do.
Absolutely. Yeah. Otherwise, I mean,
That's where the problems start.
that's when you can get yeast infections if they don't, if they're not taught how to pull back the
Yeah.
foreskin and clean. They can get yeast infections, UTIs.
And
Um,
to be real honest about the whole thing, if it doesn't happen till, let's say they're 13 and 14, that's a hard age to ask your son, will you pull out your penis so I can show you how to clean it?
this is where I really hope for boys who are uncircumcised that they have dads in their
And
lives.
that would be wonderful, but a lot of people don't. A
It's
lot of little
true.
boys don't. And so it's up to mom to, and I'm sure that,
Maybe this could be a conversation that moms could have with their boys. Like once it starts coming off, like pulling back a little bit on its own, she can say that, yay, this is great. Your body's changing. You know, it's going to keep changing.
yeah.
And as we get older, the way we clean is going to change a little bit too. And when we're ready for that, we'll go over it. But no, 13's hard because that's when they probably want privacy.
Oh, yeah.
But you need
Nobody's going
it.
to
I don't
see.
know, maybe give them a book. Like,
Oh, yeah.
like
Well, that would be, and there's video. Oh, I don't know if there's videos on how to clean the penis. I didn't check on that either.
well, I bet there would be on YouTube, like someone using like a cucumber, and here's how you do it.
And they peel the peeling off the.
Take a peeler. Oh my God. No, do not take a peeler, please,
No, no,
to
no.
uncircumcised penis. Um, but no,
So,
that's
yeah.
interesting. That's an interesting topic
And
for,
so basically, if you have a baby that is uncircumcised or intact,
yeah,
be sure to be on the lookout for any kind of infections or anything that it does not look normal, and take the baby to the doctor as soon as something like that happens, just to get it checked
yeah,
and make sure that everything is okay.
yeah, yeah. And what about taking care of circumcised
There's
babies?
nothing to that. Well, I mean, when they first get circumcised,
Yes,
and
but
that is, there's two different schools of thoughts. One is you do what the pediatrician says, which is that you take some, they usually use Vaseline. I don't use Vaseline, I use a holistic product. But you put it on the tip.
Wexling. Do you do
I
Wexling?
do Wexline.
Okay.
They put it on the tip, and then you put like a 1 by 1 square piece of gauze on top of that, and then just
Yeah.
diaper the baby. You just want to make sure that if there's any bleeding, which there shouldn't be anything more than like the size of a dime on the first day, there shouldn't be any more than that. But if it does, you don't want the penis sticking to the diaper. So I've had that happen one time, and that was hell.
Oh,
So, and the other way is if Moyle does it for the Jewish babies, they
yeah.
each have their own separate ways of doing it. So you just listen to what that Moyle,
Oil. Yeah, yeah, you
Moyle,
got it.
yeah, what that Moyle says to do. I had one that said, Nancy, just watch it for 24 hours and you don't have to do a thing. And
Wow.
he was the only one. Most of them wrap them in gauze, the whole penis in gauze. I think it's for like 7 days. And then you can't touch it, you can't unwrap it. It looks disgusting by the end of 7 days because there's poop and pee on it and everything.
Oh
End of
my
7 days,
goodness.
they clip that off, and it's just this brand new, shiny little penis.
Whoa.
Yeah, that
Oh,
one was real hard for me because I was like to the mom, this is not very sanitary. I says, are you sure that this is what we're supposed to do? She says, yes, we always listen to the mom. So
Wow.
we did, and it was absolutely fine. But they all have different ways to do it. So you listen to whomever did the circumcision, how they want you to take care of it.
Okay. Oh,
And usually it's like for 7 days you put Vaseline and Wexline on it.
yeah.
But this one, Moyle said, no, you don't need to do that. After 24 hours, he says, you're fine.
Wow. And so
So
everyone has their own, every
everyone
ex.
has their own way to do it. Yeah.
Okay.
Yeah.
Okay. And then after that, you treat it like a finger?
After that, treat it like a thing. Well, yeah, for a circumcised baby, it's nothing.
Yeah. Yeah. Great.
Yeah.
Yep.
So there's really no
Okay.
care to it as far as they don't get infections. They don't get, that is a big thing though.
Infections.
Yeah. I mean, that's a big thing to think about.
But the rate, I mean, yeah, 1 in 1,000.
No, 1 in 100
No,
for
I was going to support
uncircumcised.
you first.
Oh, thank you.
When you have when you have a circumcised baby, the rate of infection is 1 in 1,000. And when you have an uncircumcised baby, it's 1 in 100.
That's huge, Julia.
It's a huge difference. It's a huge
Yes.
difference. And your comfort level with that varies from person to person. I'm okay with those odds.
Okay.
But I also know that we have antibiotics nowadays. I'd rather not
For
if we can
sure.
avoid it, if we can avoid it, great. But I don't want to take off a part of the body in order to avoid it.
Okay.
But it might be worth it for other parents.
Yeah.
So, um, all right, everyone, if you're still with us, bravo. We made it through. It,
And I think
comment
we're still friends.
and we're still friends. We can
Oh,
have different viewpoints on this stuff, guys. And this is if there's other topics that you really want to hear us talk about, write us in or comment below. Um, we are always happy to hear from you.
so like us, subscribe to us, and
Yes.
we'll see you next time.
See you next time.
Bye bye.